All right, so here's my summary of the patient that I just worked with today. So overall, she was looking very good. The eval and the treatment went really well. She was able to walk 60 feet with a rolling walker and standby assist. Some of the gait deviations were that she had decreased speed and stride length, a narrowed base of support, and then she had decreased hip flexion during swing phase bilaterally on both of her legs. She also used a lot of bilateral arm support for her sit to stands and her stand to sits. And she lost a little bit of control at the end of her descent from her stand to sit. And then overall, grossly, she has a 4 out of 5 MMT score. So overall, she was doing really well, but it's just kind of, like getting her back to that strength and endurance of being able to do the things independently that she was once able to do. So how I addressed those today was we did a couple interventions. We did some stair negotiation exercise, standing marches, and then a couple exercises where I had her walk in tandem. So for the stair negotiation exercise, we originally were kind of doing this with a cane, and just working on setup at home, how would she go upstairs? And we were kind of trialing how she was on stairs because this wasn't something that was in the eval. So I did that, and then and then with the standing marches, I had her doing that with a small base quad cane. And overall, she was doing both of those exercises really, really well. Her heart rate honestly didn't go up very much, so I did have to make those exercises a decent bit harder. So we ended up with the stairs, like she was a pro, honestly, and didn't need any kind of cane support from my, clinical reasoning. So we ended up putting some 3 pound ankle weights on both of her ankles and doing like a timed intervention on the stairs, and she did really well with that, honestly. And then with the tandem exercise, I just was kind of doing some walking in tandem, just kind of down the hallway, and I was there for handheld support as needed. And then kind of thinking about what I want to do next, I kind of want to focus some of the future treatments on a little bit more balance activities. Just I think it'll be good at working her endurance overall and just her balance a lot more because like overall like her strength is there and we'll still work on improving her to increase her strength, but I feel like working on some of the balance components could be a lot more beneficial and might help her feel a lot more stable in her gait too. So I was thinking of doing some activities like a 30-second sit to stand exercise to kind of involve both the legs to get the lower extremities working and to kind of work on some of that balance, or maybe like a tug like sort of a scenario. And then I wanted to do more walking activities when challenging the patient's balance. So like, I did the walking on in tandem, or we could do like walking like cone taps. And then one of the last things I was thinking of was kind of just like making it more functional, like having her go to like reach for things while she's walking and negotiating around. So, a couple things that I thought went well for me was my ability to analyze my patient's activity limitations in this session today and their impairments. So, I felt like I had some clear direction when I was coming up with interventions because I felt like I kind of found all of her limitations and impairments going on. And I also feel like communication is just one of my strengths too. So, I was able, I think, to build some good rapport during the exercises today and kind of help her get a little more motivated. And a couple of things that I want to improve on is making sure my interventions are the just right challenge. I think I can improve in that aspect. I feel like I tend to like start with things a little easier at first because I'm not sure how the patient's going to handle it. But I think I need to realize that I can overall challenge patients more than I think I can. And then, yeah, originally my interventions were too easy, so I just had to increase the intensity. But yeah, overall, I think this session went really well, and I'm excited to work on some of those balance tasks and things. And if you have any thoughts for me about how it went or thoughts about my interventions, let me know. Thanks.